without having to pay extra or ask permission or jump through ridiculous hoops. We're here to make sure when birth control is available to everyone over the counter, it is also affordable for everyone, because affordability is access. And today we are closer than ever to over-the-counter birth control. Just last week, the FDA's advisory committee took the huge step of recommending the first ever application for an over-the-counter birth control pill, and they did it unanimously. So this is not a question of science and data. That part is settled. The results are in, the experts have spoken, and they have confirmed what millions of women across America have known for 6 decades. The pill is safe and effective and essential. Birth control is already available over the counter in more than 100 countries. It is long past time that we were one of them. But it's not enough for an over-the-counter birth control to be approved. For it to be accessible, it has to be affordable. And that is why we are here today, to reintroduce the Affordability is Access Act, and I'm so glad to be joined today by my colleagues, Senator Hirono, Senator Cortez Masto, who have been just amazing, great partners in this fight, and by Dr. McDonald Mosley with Power to Drive. The Affordability is Access Act will make sure that once the FDA determines an over-the-counter option to be safe and effective for use without a prescription, that pill is fully covered by insurance, just like every other FDA-approved birth control. And this is really important, especially in this post-Roe nightmare when far-right Republicans across the nation are rolling back reproductive rights, pushing radical and dangerous abortion bans, and making clear they are coming for birth control next. We know the MAGA Republican vision for the future, and it's dark. That's why we have to fight for our vision of the future, a future where getting the birth control that you need is as simple and easy as picking up Advil or Tylenol at the pharmacy. No hoops to jump, no questions you have to answer, and no extra cost. A future where all women will have the power to make their own decisions about their bodies, their health, and their future. That's what this bill is about, and that's what we're fighting for. So I'm delighted to turn it over to my good friend, Senator Mazie Hirono, who has been in this battle forever. Thank you.
Thank you very much. Aloha. So many of us have been in the battle to ensure that individuals in our country can control their own bodies, and that of course includes decisions relating to abortion. And Patty and I have been doing this for decades, as has Doctor, who's next to me. But the fight continues, and especially too many states now are foreclosing just about every opportunity for us to gain the kind of control over our bodies, including access to contraception. And now we have, for the first time ever, the potential, and one hopes that science-based approval by the FDA of the first ever over-the-counter contraceptive pills. And you can bet that there will be a battle over the ability of us to access this FDA-approved contraception. We do have an agency called the FDA that determines through science the effectiveness and safety of medication. And the kind of attacks that are being mounted against the FDA on this, as well as mifepristone, is a danger to just about every other medication that we all take for granted upon FDA approval. I can't add anything more to what Senator Murray has said about how important it is that this particular over-the-counter contraception is not only available, but it's affordable through insurance coverage, and that is what our bill will do. Once the FDA approves this over-the-counter medication, that the insurance companies will cover it. Because what is the point of a pill if it's not affordable? And there are literally millions of women in our country who should be able to avail themselves of this FDA-approved, safe pill. So now I want to turn it over to our doctor here, who has been in the fight for, I don't know, decades probably.
Yeah.
Okay. Thank you.
Thank you. Good morning. Thank you to Senators Murray, Hirono, and Cortez Masto, and Representatives Presley and Ocasio-Cortez and Barra for this critical legislation. We're so grateful for your leadership. My name is Dr. Reagan McDonald Mosley, and I use she, her pronouns. I'm the CEO of Power to Decide, a nonprofit organization that works to improve reproductive well-being for all people, focusing on those who have the most barriers to information and access. I'm also a practicing OBGYN who provides contraceptive care to my patients, and I can tell you that my patients and millions of others like them struggle to get birth control access. In fact, Power to Decide's research shows that roughly 19 million women in need of publicly funded family planning live in contraceptive deserts, which means that they live in counties where they lack reasonable access to the full range of birth control methods. We know that people living in contraceptive deserts are more likely to be people of color and those living in rural communities, all of whom face systemic inequities in access to health care. They have to travel further, arrange more childcare, and take more time off from work to get the birth control that they need. But there are methods of contraception available over the counter right now. And last week, the FDA's Expert Advisory Committee voted unanimously to recommend approval of the first ever over-the-counter birth control pill in the United States. And they did so knowing that what we providers know, that the pill is safe, effective, and that most people don't need to see us in order to use it. We urge the FDA to follow the recommendations of its advisors. Too many people struggle to get a provider in the first place. And we face a national crisis in access to reproductive health care right now. We want everyone to get the birth control that's right for them, and we don't want a prescription requirement to get in the way. We also don't want that barrier to stand in the way of people being able to afford their birth control. That's why the Affordability is Access Act is so necessary. Insurance plans must cover all methods of birth control, including over-the-counter methods. But right now, most require a prescription to do so. And that means that the person has to navigate to a provider to get coverage. This puts the burden on those who struggle to get to a provider, those facing systemic barriers to access, living in contraceptive deserts. For these people, a requirement for insurance plans to cover these over-the-counter methods without a prescription will provide them with the more equitable access to contraception. And that's what this bill will do. And that's why this bill is critical to achieving contraceptive equity. I want to thank these congressional champions for all that they do on behalf of my patients and the millions of people who are struggling to access reproductive health care that they need right now. Power to Decide stands with you because everyone deserves the birth control that they need to live their lives on their own terms. Thank you.
Thank you, Dr. McDonald Mosley. Senator Catherine Cortez Masto is also a great supporter of all of us, has worked tremendously hard for this, and is joining us as I try to slowly talk. Catherine, great. You're up.
Thank you. Thank you. Thank you, Doctor. Good morning. Thank you, everyone, for joining us this morning. I am so pleased to be able to join my colleagues with Senator Murray, Senator Hirono, and everyone with us today. Thank you. Because birth control is health care, let's just be frank. It is an issue every woman should be able to access, and it's that simple. The fact is that women's rights are under attack in this country. We knew the far right wouldn't stop at the repeal of Roe versus Wade, and since the Supreme Court overturned Roe, right-wing extremists have been working overtime not only to take away a woman's right to choose, but to control women altogether. We saw this coming. We saw it coming. We've been talking about it. We cannot allow it. I stand with a majority of Nevadans and Americans who believe women should be able to make their own healthcare decisions. That's why I am proud to introduce the Affordability is Access Act to ensure that women have affordable access to FDA-approved over-the-counter birth control. Comprehensive coverage for contraception will empower thousands of Nevada women to make decisions about their lives, their health, on their own terms. And let me just say, as a woman, contraception was for me about my health. That's what this is about. And unfortunately, for those that do not understand it, they need to trust women. I trust women to make these decisions, these personal decisions about what's needed for their own health care. And so we need to continue to be able to have women access the essential medications that are important for their own health. So thank you. Thank you for joining us. Doctor, thank you for being here as well.
Thank you, Catherine.
Senator, thank you.
All right. Happy to take any questions. If not, we're introducing this bill today, and we're going to work hard to get it passed. Thank you all so much for being here.
Yeah, man. Just in time for the next one. What's over here for? Yeah. Are you cool for me or something? Okay. No, yeah, they were talking about having me go through it. Here we go.